top of the hour, let's get you the updates that we are picking up from the state of Punjab, because the indefinite strike by Punjab's 108 Ambulance Employees Association has now entered its third day, where the contractual employees are on a strike since the day before yesterday, demanding that the Aam Aadmi Party Sarkar take back the control of the service from the private company. More than 300 ambulances that are stationed at the toll plaza in Ludhiana, and the contractual employees are demanding the cancellation of the renewed contract with the private emergency medical services provider. The prime demand is a pay hike from 9,500 rupees to 35,000 rupees, with an employee pay rise of 10% annually. They have been saying that the pay structure has been the same for the last 12 years, and along with the compensation of individuals hurt in accidents due to condition of the ambulances, they have also asked for the reinstatement of those workers who the corporation had sacked previously.
पंजाब में एम्बुलेंस कर्मचारी अनिश्चितकालीन हड़ताल पर चले गए हैं। पंजाब में 108 नंबर के तहत आने वाली करीब 300 से ज्यादा जो एम्बुलेंस हैं वो पूरी तरीके से बंद कर दी गई हैं। आज अनिश्चितकालीन का हड़ताल का दूसरा दिन है और इस वक्त लुधियाना में लाडोवाल टोल प्लाजा के पास पूरे प्रदेश की जो एम्बुलेंस हैं, जिनकी संख्या 300 से ज्यादा है, इस वक्त यहाँ पार्क की हुई है। और आप तस्वीरों में देखेंगे, जहाँ तक नजर जाती है वहाँ तक सिर्फ जो एम्बुलेंस हैं वो नजर आ रही हैं। तमाम जो कर्मचारी हैं, एम्बुलेंस सेवा से जुड़े मरीज हैं, उनको भारी किल्लतों का सामना करना पड़ सकता है। और क्योंकि जो कर्मचारी हैं उनका ये कहना है कि उन्होंने सरकार को कई बार चेतावनी दी, पहले बता दिया था कि अगर मांगे नहीं मानी गई तो हड़ताल की जाएगी, और उसके बाद अब हड़ताल का जो फैसला है वो ले लिया गया है।
Well, training guns on the AAP Sarkar, the BJP has said that Bhagwant Mann government has all the money in the world to spend on advertisements, but none to give when it comes to those lifesavers. Well, one can also talk about, even as the party seems to absolve itself or to turn an apathy, a blind eye to the apathy, because if we talk about previously, in 2013, the cash-strapped government purchased at least 2 choppers for the Chief Minister and for the Deputy Chief Minister, spending over 100 crores. That was the same time when it was Shiromani Akali Dal and the BJP at the helm of the affairs. But in 2018, over 400 luxury vehicles were approved by the Punjab Sarkar for the Chief Minister, the Chief Minister's MLAs, even the bureaucrats. This was the time when Amrinder Singh was in the Congress and was the Chief Minister. But can the current Bhagwant Mann Sarkar wash his hands off? Because immediately after coming to power in the state of Punjab, the Aam Aadmi Party government in the state has spent over 30 crores just on advertisements in news channels, in radios, in newspapers. And this is our RTI report. And not to forget, when it comes to additional 3 crores was spent on Bhagwant Mann's 17-minute swearing-in ceremony. But when we asked those direct questions there from the Aam Aadmi Party, there was no response.
पंजाब में एम्बुलेंस सर्विसेज 108 एम्बुलेंस सर्विसेज बिल्कुल ठप पड़ी है, क्योंकि इसके एम्प्लॉइज जो हैं वो स्ट्राइक पर चले गए हैं। 72 घंटों से स्ट्राइक पे हैं, मरीज तड़प रहे हैं, हॉस्पिटल ले जाया नहीं जा पा रहा उनको, और किसी की कितने भी खतरे में जान क्यों ना हो, वो चाहे तड़प तड़प के मर जाए, पर उसको एम्बुलेंस नहीं मिल रही। क्यों नहीं मिल रही? क्योंकि आम आदमी पार्टी ने सारा पैसा पंजाब से, पंजाब का पैसा उजाड़ा है गुजरात, गोवा, हिमाचल जाके। सैकड़ों करोड़ रुपया प्रचार में लगाया, सैकड़ों करोड़ रुपया जो
party government's failure, its lack of ability to keep promises, and its constant U-turns. These are long pending basic demands that should have been fulfilled. The Aam Aadmi Party government made a lot of big promises, but now when the time comes to fulfill these promises, instead of that, when they strike or they protest for their rights, then strong action is taken on them. Farmers and teachers are beaten up and roughed up. One hopes that no adverse impact happens because of this protest, and that this protest should be called off as soon as possible, because people's lives are at stake. But the government must be held responsible. It is an utter failure on the part of Bhagwant Mann and his government. They are more interested in just canvassing and campaigning for elections, for advertisement.
Well, just think about the people there, because who are in a rush and are seeking emergency services to get the people who are affected to the hospital. How can they do that then, Karan, if looking at the kind of strike that has now been called in by the ambulance service providers?
Amita, So not one party can absolve itself of the crisis that Punjab is facing right now. Lives of many people are hanging in balance as this emergency service has been stopped at many places. So the issue has been long due. In 2013, the Shiromani Akali Dal and BJP government had spent around 108 crore rupees to buy choppers for the CM and the Deputy CM, but as of now they claim that they do not have money and the government is cash strapped. Then again in 2018, the Amrinder Singh government sent around 80 crore rupees for buying luxury vehicles for the ministers, officials and the CM. Then again in 2022, the Bhagwant Mann government had spent around 3 crore rupees for the 17-minute oath taking ceremony. So this issue has been long due since 2013.
All right, so what is being said as far as the government here in the case is concerned, saying that probably if they do not take back their protest, we also have Gurpreet and Manish joining us here on the broadcast. Now they have been issuing advisories, Gurpreet, that if they don't take back the strike, the indefinite strike that has been called in, then disciplinary action would be initiated against them.
Well, at the same time, we have seen that these employees, they have already intensified their protest. What we have learned from the various union leaders, they say till the 15th of January, they have given an ultimatum till 12 o'clock. If the meeting is not going to be arranged with the Chief Minister, they will block all the national highways and all the state highways, because they want to pressurize the state government why their issue and why their grievances is not addressed. At the same time, they are also claiming on 9th of January they had a meeting with the health minister, but nothing has come out. Now the main demand is very clear. They want that the private company under which they are working, that should be taken over by the state government. At the same time, the salary should be increased, because for the last so many years they have been working on the same salary, and inflation has already gone manifold. At the same time, we have seen the state government is not responding to their calls also. They are saying the peaceful protest is being held at the Ladhowal of district Ludhiana at the toll plaza, where we have seen around 300 ambulances have been stationed there, but they are not stopping and not halting any moment on the highways. But now they have already intensified and had given a very clear-cut ultimatum to the state government. If there will be no meeting with the chief.
They are preparing for an indefinite strike and to intensify the strike further to put pressure on the Bhagwant Mann Sarkar. They're pleased to stay on with us. Let me introduce our guest, Mr. S.S. Chani from the BJP is with us here on the broadcast. Sir, good afternoon. Dr. Akashdeep Muni, political analyst, and Dr. Sanjeev Bagai also with us here on the broadcast. Mr. Muni, to you first, because the services that were started way back in 2011, that was the aim to provide free transportation to the patients with the 108 ambulance services that has been in the private hands since the start. And even we are told that the contract has been renewed, but at what cost, sir? The people there, the ambulance service providers and the drivers there have been saying their salaries have not been paid.
See, first and foremost, ambulance services are part of the essential services in this case particularly, and they are life-saving, and this is a very serious matter in case they go on strike. I think the state government should invoke Section 3 of Essential Services Management Act, which is ESMA, and they should ensure that these ambulance...
You're saying take action against those protesting drivers?
No, they should do it, and every state has done it. Essential services, they should not go on strike out of the blue. However, on your case, your question on the increase and on the salaries thing, they have got increment recently, just 3 months ago. And they are as per the guidelines of the government. And they want more increment. For more increment going on strike.
But the main demand is to actually remove it from the private contractor's hand and to make them as a full-time employee under the Punjab Sarkar. Mr. Channi, because what's the explanation coming in from the AAP Sarkar is that the wages of the ambulance service providers was fixed according to the Punjab government's minimum wage notification, and they have already been given an increase in pay in October last year along with the arrears that were due to the staff. So why are they protesting now?
Amita, the thing is that I tell you the achievement of the AAP government since Bhagwant Mann has taken over. Now we are having third health minister, whereas they say that health sector is the topmost priority and education of the AAP government. Now they have problem with the AAP government is that people are not asking for fresh or new demands. People are asking to fulfill the promises. And there is no government worth the name. You talk about the toll plazas, you talk about the farmers, you talk about other all kinds of employees. Everybody is on strike or have given them the notices. But they don't have the courtesy even to have a meeting with all of them and tell them that what is possible, what's not possible.
Because, sir, we are playing out ground reports, sir, and Dr. Bagai, as a neutral person, not having any association with politicians who have here on the broadcast, sir, what is being said that even when it comes to private firms who are running such ambulances have been charging exorbitant prices just even for a shorter duration or a shorter area, even that kind of headache that has been provided to the patients who have to go for an emergency, sir.
Good afternoon. I think ambulance services have long time been neglected. I think they need their due importance. We have to look at a basic minimum wage. What I've been reading on the net is 9,000 rupees in Punjab versus 35,000 in other places. In fact, the AAP government is in Delhi too, and the Punjab ambulance drivers are getting less than the minimum wages of unskilled labor in Delhi, which is unfair. The working conditions, the basic amenities such as health insurance, standardization of charges. I think we need to unify the government and the private sector as far as ambulance is concerned, because this is your mainstream of capitalizing your golden first hour when a patient is critical. I've also been following the healthcare in different states very carefully. This is complete abject apathy. Criminal waste of taxpayers' money in Punjab on advertisements, on luxury items, on choppers and luxury cars. What nonsense is this? This is not
all of those political parties there. It is not just about the Man Sarkar, but right now because it is in power, as we are questioning them. Let's play out even a sequence of events that we have captured when we directly pose those questions to the Aam Aadmi Party's Atishi.
Quickly, I'll take that question to Atishi as well. Atishi, there's one important thing which is coming in breaking right now. I just want to take one reaction of you. 108 ambulance services suspended by the Employees Association in Punjab as well. Ma'am, what you wanted to say on this, because this is something which has been trouble where Atishi not responding on the question over there in...
All right, so no reaction coming in from the Aam Aadmi Party. However, when it comes to Manoj, अगर मैं आपके पास आऊं, क्योंकि ग्राउंड रिपोर्ट्स ये सजेस्ट कर रही है कि जहां तक जितने प्रोटेस्ट में बैठे हैं वो ये कह रहे हैं कि उनके जो वर्किंग आवर्स है उनको भी घटा दिया जाए इमरजेंसी रिस्पांस टीम का, और जहां तक जो स्टाफ जिनको पहले निकाला गया था उन्हें रीइंस्टेट किया जाए.
बिल्कुल, देखिए कई मांगे हैं, लेकिन मुख्य मांग यही है कि जो प्राइवेट कंपनी के थ्रू इनको संचालित किया जाता है इसको हटाकर सीधे पंजाब सरकार उनको अपने अंडर ले. और उनकी मुख्य डिमांड जो है वो कह रहे हैं कि हरियाणा सरकार ने भी 108 जो एम्बुलेंस हैं जो सुविधाएं उनको दी हैं उसी तर्ज पर उनको यहां पर बेनिफिट दिए जाएं. और ये तो अभी तीसरा दिन है, आज वो बैठे हुए हैं शांति से, और अब अल्टीमेटम ये दे दिया गया है कि हाईवे जाम कर देंगे अगर कल 12 बजे तक उनकी मुलाकात पंजाब के मुख्यमंत्री भगवंत मान से नहीं कराई गई. पंजाब सरकार ने अभी तक एक बार मीटिंग जरूर की है हेल्थ मिनिस्टर ने इन हड़ताली कर्मचारियों के साथ में, लेकिन उसके बाद से कोई इनिशिएटिव अभी तक लिया नहीं गया है. पंजाब सरकार कर्मचारियों को कह रही है कि वो टाइम दे, एक कमेटी बना दी जाएगी जो इस पर विचार करेगी, लेकिन कर्मचारी अब इस मूड में नहीं है कि वो वेट करें, और इसीलिए जो हड़ताल है वो और ज्यादा इंटेंसिफाई और बढ़ती जा रही है. जी
बने रहिए हमारे साथ मनोज. डॉक्टर मुनि, ये इमरजेंसी सर्विसेज आर गेटिंग अफेक्टेड सर, क्या कार्रवाई करी जाएगी सरकार से?
मुझे लगता है कि the health minister has talked with the protesters, and what my friend was saying, he was actually incorrect that there has been no initiative. When the health minister has assured the protesters that due action will be taken, then they should call off the protest. And of course, if...
No, but you're also talking about disciplinary action against the protesting ambulance service providers.
I'm not talking about disciplinary action. I'm talking about the section, what the Constitution says. Section 3 of ESMA says that clearly essential services, they cannot go on strike. And I think that they should not go on strike. I think that the government should have imposed ESMA by now, because the common man at ground should not be affected by these all strikes. An increment is not equal to the life of a common man in the ground.
Then it should have been done before, Mr. Channi. That's the point, because now what is being suggested that not just the Sarkar, even the company is proposing to take action or initiate disciplinary action against the protesting ambulance service providers.
Amitabh, the thing is that this speaks about the high-handedness and also the insensitivity of the government. Now the government is being headed by Bhagwant Mann, and he should take care and confidence of each and every citizen of the state and also the employees. Now nobody is very happy about going on strike and leaving his work, but they are not at all in a position to. Now there has been strike, mass leave by the PCS officers. They have everything. They are not in a position to address the issues and satisfy or give some justification to the
But there are stark
agitating
contrasts as to what the Sarkar has been saying and also what those protesting individuals have been saying. Dr. Bagai, last comment from you, sir. When it comes to hospital and private services, do you believe at the hand of what the providers have been talking about? Because there have been over 300 ambulances in the state that are being run by such private care limited companies on contract. How valid are their demands?
Yeah, so really, I think the demands of every person who is an unskilled or skilled labor, medical or paramedical, is just. But the real question is, why has the situation been brought to this level? It should be addressed on an urgent basis. You sit down with them, integrate the services. Ambulance cannot be run as government separate, private separate, because the patient is the same. I think this is completely unfair as to what is happening, and I want the government to actually resolve this on an urgent basis. It's important to look at life, not lifestyle of the politicians. Look at life of a common citizen. They cannot be suffering for want of healthcare. Invest more in healthcare. I see the political analyst who's representing the government in that state smirking. It is so sad to see his face. He's smirking at the plight of a common person who's struggling to get an ambulance or an emergency vehicle.
You are unknown of basic facts. Private and government, both ambulances are there throughout the country. So Pradesh has it.
Please have the
patience. Protest हो रही है ना सर, Dr. Muni. पूरे country में तो protest नहीं हो रही है ना सर. If the employees there are raising an issue and they have been saying that the salaries have not been paid and they are giving an ultimatum to the government, ये नौबत ही क्यों आई सर?
Salaries has been paid. They just want the change of hands from a private subscriber to a government subscriber. Of course, that will be done. There has been assurance by the health minister. He has personally gone and spoken to these people, but they want a confirmation from the CM. This is the whole case. They just want to meet the CM. This is the case, and my
so you're saying that when it comes to the protesters, they are holding the state at ransom. Such kind of demands that you've been saying is not completely something that will go well with the Sarkar, because there are both, Sarkari and private ambulance service providers. But this is now the patients that we are talking about. Their health comes first. Their restoring of those ambulance services should have been the topmost priority of the Bhagwant Mann Sarkar. Thank you very much to all our guests and reporters joining in. We'll be getting you more ground updates exactly when it comes to the ambulance service providers who have now given a 72-hour ultimatum. If the demands are not met, they will continue with their indefinite strike. Back after a short